Hello, everyone. Hello, everyone. Thank you for your patience. Good morning, good afternoon, and a big welcome to you all wherever you're joining us. My name is Azar Abadi, and I will be hosting today's webinar. Just a few housekeeping notes before we get started. This presentation will be followed by 10 to 15 minutes Q&A, and then I will hand it over to Alison Bear, who will be hosting the early career development section. Please ask your questions in the chat to participant name Ask Questions. Finally, please make sure that your video and audio is off during the presentation, and this presentation will be recorded. Today, we have Dr. Jessie Bell here with us to talk about Nexus of Water, Climate and Health, developing a university-based program. Dr. Bell is the Claire M. Hubbard Professor of Water, Climate and Health in the Department of Environmental, Agricultural, and Occupational Health at the University of Nebraska Medical Center and the School of Natural Resources within the Institute of Agriculture and Natural Resources at the University of Nebraska-Lincoln. He is also the Director of the Water, Climate and Health Program at UNMC and the Director of Water, Climate and Health at the University of Nebraska's Doherty Water for Food Global Institute. His expertise and research are focused on understanding the impacts of changes in the environment and climate on natural and human processes. Without further delay, I'll hand it over to Dr. Bell.
All right, thank you, Dr. Abadi. Really appreciate it. Sorry I had a few technical glitches before I was able to get everything going. So hopefully you hear me okay. Hopefully you see everything okay. So yeah, as Dr. Abadi said, I'm going to be talking about how water, climate, and health kind of meet together and this new university program that we have here at the University of Nebraska that kind of expands across both the University of Nebraska-Lincoln and the University of Nebraska Medical Center. And so when we talk about water, a lot of times when we're talking about water, there's a number of different issues that can arise with water. You can either have too much water, you can have too little water, or you can have not clean enough water. And so we see that here in Nebraska, we see that across the United States, and we also see that across the globe. And so this isn't really an uncommon problem. But when we talk about it, and so because it's not an uncommon problem, it is also something that we're very well aware of, and there's a lot of work going on, but there's real opportunities to try to bring people together to better understand and better address some of these issues. And so the way that I'm kind of looking at it is in that nexus of water, climate, and health, because they all kind of overlap in a variety of different ways. And that's what we're trying to achieve here at the University of Nebraska is trying to better understand how water, climate, and health kind of that come together and what that actually means for human health, the health of individuals here in Nebraska and across the state or across the region, and then also across the United States and the globe as well. And so we were very fortunate. We received a gift to the university of about $5 million. And this gift was to better understand, to help build this program, build this initiative, to better understand how water, climate, and health are impacting Nebraska and how we can better learn from some of these areas of both water quality and quantity and what that actually means in the terms of human health. And so this isn't obviously just UNMC. One of the areas that is a part of this is through the Water for Food Global Institute, which goes across the entire University of Nebraska system. And so they play a very intricate role within this water, climate, and health program. There's a lot of overlap because we have the Water, Climate, and Health Initiative that's over at DWFI, which is the Water for Food Global Institute. And then we have the Water and Climate Health Program that's over at the University of Nebraska Medical Center. And the way that I look at those two is there's a lot of overlap between those two institutions. It's really hard to say where one begins and the other one ends. And because of that, there's a lot of opportunity for collaboration. And so that makes it so that our Water, Climate, and Health program isn't just focused on the University of Nebraska Medical Center, but has that ability to spread across the entire University of Nebraska system, which we have 4 different campuses, if I'm remembering correctly, 4 different campuses, University of Nebraska-Lincoln, Kearney, Omaha, and then our medical center. So just to give you a little bit of a background on the Water, Climate, and Health program, this is obviously an initiative that we're in the process of developing as we're moving forward. So the funding that came in for this program really came in 2020. And it was like the latter part of 2020. And so we're now getting close to about a year and a half to almost 2 years of developing this program. And we've seen a lot of development as we've come along the way. Like I said, a majority of our funding came from the Clarum Hubbard Foundation. And the whole premise of this was to build interdisciplinary collaboration across the University of Nebraska system to try to address Nebraska's public health challenges related to water and climate, and doing that through research, education, policy development, and training. And it was really important that we have those different aspects, because we don't want to just do research for research. We want to make sure that we're actually engaging within the community, because we have a number of challenges that we face here in Nebraska and within the region and across the United States and the globe that really need that integration of science to make sure that we're actually solving some of these problems and not just pointing at some of these problems. And so with that, one of the first things that we did was really try to build a team around this program to make sure that we have the resources that are available to address some of the issues. And that part of that is bringing together resources that are already existing at the University of Nebraska. I'm the director. Dr. Rogan is the associate director. We also have a director of operations, Megan Langle, director of biostatistics, Yongjin Guan, director of public health policy, Rachel Luckadoo. We have researchers that are assisting with us, City and Dr. Babak Vard, including others, and we'll talk more about that in a bit. And then we have student involvement as well. And so we have Jagadish, Balkisa, and Aziz, who are all three are PhD students. We've also had MPH students working with us, and we have a new crop of MPH students that are hopefully coming in soon. And then we also have medical students that are engaged in this and doing research and work within the Water, Climate, and Health program. And I want to talk about that in a little bit as well. And so, that's kind of the framework, and this is where we're building, and we still are trying to continue to build. And there's a number of different things that we're trying, different initiatives. And I'm not going to be able to talk about all of them, but I'm hopefully going to be able to highlight some of the main ones. Two big things that we have coming up is we're working with Nebraska Extension for a source water extension educator position. That person is going to be within Extension, but also be working very closely with the Water, Climate, and Health program to help with building relationships across the state, getting information, getting science out across the state. And then in addition to that, through the Water for Food Global Institute, we have a postdoctoral researcher that will be coming on trying to better understand some of these water quality issues and what does that actually mean in terms of cost, especially associated with healthcare and medical care. And so we have a number of initiatives that we're trying to move forward on. We're constantly trying to build relationships across Nebraska, across the region, and across the globe. And this is where we're kind of at this point. And so I'm going to talk a little bit about some of our research and also some of our initiatives in a little bit more detail. First, before I do that, I need to talk a little bit about Nebraska. I'm guessing many of you, if you're not from Nebraska, probably don't know a lot about Nebraska. A lot of times Nebraska isn't always the state that's being thought of, and it's not usually the first state when people think about going on vacation. Although there is a lot of really beautiful areas within Nebraska to see. Nebraska is ranked 43rd in population density. It's 16th in terms of size. 1 in 3 individuals in Nebraska live in basically 2 cities, Lincoln and Omaha, Lincoln being the capital, Omaha where I'm located right now. 89% of our cities, towns, have less than 3,000 people. And so, as you can imagine, we have a lot of small communities across Nebraska. Over 53% of our counties are reporting decreases in population. And 85% of Nebraskans get their drinking water from groundwater. And so down here you have a picture of Nebraska. If you're not familiar with it, it's right in the center of the United States. And this is a showing where population density is greatest across the state, with the darker colors, darker red colors, indicating highest density levels. And so as you can see over here, the very darkest is Douglas County, where I'm located, which is Omaha, Nebraska, is where Omaha, Nebraska occurs. And so we're definitely a very rural state. And with that, that's where a lot of attention goes. And we definitely, within the water climate and health program, are definitely focused on rural areas, but we're also focused on urban areas as well. And we have challenges in both regards, both in urban and rural. For example, Omaha, Nebraska, where I'm located, is a very historically segregated city. And some of that segregation within the city goes all the way back to historical redlining, which many of you are probably familiar with. These were financial practices that were put in place in the mid-1900s that basically were focused to make it more difficult for certain communities to get financial loans and access to resources that were necessary for development. And a lot of times that redlining that occurred was focused on areas where you saw higher populations of individuals of color, and then also ethnic minorities as well. And so we can still see some of those impacts on the state here now, today, or within Omaha. We can still see some of those impacts within our communities here, both on health disparities, but also access to infrastructure and a variety of different issues. And so, a lot of times when you think of Nebraska, you think of rural challenges, but again, this is just kind of highlighting that we do have urban challenges as well. We also have health threats that we face here in Nebraska. Nebraska does face some pretty significant health threats. One of those, and I'll talk a little bit about some of the work that we're doing around this, is looking at pediatric cancer. We know that Nebraska has one of the highest rates of incidence rates of pediatric cancer in the United States. And there's a number of different potential reasons for that, but I'll talk about one that we're in particular concerned about. And so when I talk about the water, climate, and health program, and I kind of address that at the very beginning, we address water quality issues and we address water quantity issues. And when we're talking about water quantity, especially here in Nebraska, we're talking about flooding and drought primarily. Nebraska is definitely very prone to both of these events. And I'll talk about some of the potential impacts that we're already seeing here in Nebraska around both flooding and drought. And then we face a number of different issues associated with water quality. With water quality, we have some natural occurring contaminants, such as arsenic and uranium that you can find in our groundwater, to agrochemical potential contaminants that we also see. And some of those are, for example, nitrates and atrazine, pesticides, insecticides, that we see within our waterways. And I'll talk about that in a little bit more depth in just a bit. Nitrate in particular in Nebraska gets a lot of attention. It's definitely been a big area of focus. And I'm going to talk, like I said, I'm going to talk about this more as I move forward, because this is definitely one area that we're concerned about. Many small towns are paying millions of dollars. And so, as I said, many of these small towns are less than 3,000 people. And when their water becomes contaminated, now all of a sudden they have to pay millions of dollars for potential remediation efforts. And so, as you can imagine, this can be very impactful for some of these rural communities where you don't have a very large population base, to try to support some of the funding that is necessary for trying to do that mitigation. And so, to kind of kick it off, before I go into the water quality piece, I want to talk about the water quantity piece before I go into the water quality piece. And with that, that's really where we get that climate part of that nexus. And changes in climate have direct impacts on human health and have direct impacts on water availability and water quality as well. And so when we think about climate, we're thinking about it in the context of the direct health impacts and the indirect health impacts. The direct health impacts are those things that you see immediately, such as when an extreme heat event occurs or extreme weather occurs. Those things, you can see those impacts. They're very apparent. They can send people to the hospital. You can easily identify that that had an impact on your community. And then there's those indirect health impacts. Those indirect health impacts can come both from climate change, the slow gradual change that we see over time, but it can also come from when we see one of those abrupt events, like an extreme weather event, things that happen over longer periods of time. And so that's the spreading of disease, disruption of food and water supplies, disruption of well-being. And I'll talk about some of those and some of the work that we're doing with that. And before that, and all of you are probably very well aware of this, but it's always good to just kind of put it up at the front. Climate change is a significant threat to the health of the American people, and every American is vulnerable to the health impacts of climate change. There's been a number of different reports, one of them that came out of the White House in 2016, for example, that talks about this and very clearly illustrates that these health impacts, or that there are a number of health impacts that are associated with climate change. And so one of the things I just wanted to throw up here is so that we can better understand how we get from climate drivers to human health outcomes, and looking at this exposure pathway, this causal process diagram. And so up here you have your climate drivers. You have your increases in precipitation, changes in temperature, changes in extreme weather events, sea level rise, which really isn't much of a problem for us here in Nebraska per se, are not the same level of problem as coastal regions. And then we have the exposure pathway. And from there, you have the change in environment, and that change in environment then can lead to human health outcomes. And one of the reasons I think it's really important to put up this figure is because we really need to focus on both the social and behavioral context and the environmental and institutional context. Social and behavioral is, that is the individuals living within your community. What is the age, race, gender, ethnicity, discrimination, access to care issues, pre-existing health conditions, all these factors. And then you have the environmental and institutional context, which is basically what is the environment that you live in? What is the infrastructure of the environment that you live in? Those things can, one, be affected by climate itself, but those are also the things that potentially impact this pathway. When we see changes in our climate or climatic events, when those occur, we can see human health outcomes. And the reason I put that up there is those are the things we can better understand and even potentially influence and change to try to reduce human health outcomes as we're seeing changes in our climate system. And one of the points I really try to put up at this point is because sometimes some people hear this and they hear climate potentially causes human health, and they're like, well, that's unfortunate. But and that's true, but what we do to prepare and respond to climate change and also climatic events influences the potential outcomes. And that's one of the points that I really try to put up here. And one of the reasons why healthcare and public health are so important in this discussion is because we really need to understand those pathways and understand what's influencing those pathways so that we can help better prepare our communities to reduce the potential health impacts. And so, and when we talk about what populations are potentially at risk for the health impacts associated with climate change, there are 4 populations that typically pop up, especially here in the United States: communities of color, children, low-income communities, and older adults. And that gets to a lot of those infrastructure, the gray boxes that I was talking about. It gets at a lot of the infrastructural issues in some of these communities. It gets at some of those social determinants of health, those pre-existing health conditions. It also talks about discrimination, racism that some of these communities face, and where they occur, and a variety of different issues that can lead to these populations being more at risk than other populations. And like I said, all people in the United States are vulnerable to the health impacts associated with climate change. We can say that across the entire world, but certain communities are more at risk than others. And there's one other that I kind of want to throw in here, because I think it's important to talk about, especially considering that we're from Nebraska, is rural populations, because they kind of fall into that category in a variety of different ways, into those populations that are potentially more at risk. One, I am from rural Nebraska, and so I decided I'd put a couple of photos of me, one as a kid catching a fish, and another one of me working on a farm, to illustrate that I'm actually from Nebraska, give me a little, and from rural areas, give me a little bit more credit at this point. And so rural populations, they have a variety of different issues that they face as well. Healthcare. In rural areas, we typically have higher rates of uninsured people. There's healthcare shortages in many of these populations, especially, and it's very prevalent in rural areas. You have less likely to be able to access specialty or subspecialty healthcare. And transportation is a big issue. And I'm going to talk about that a little bit later in my talk. And then you have socioeconomic issues as well, lower rates, lower income rates, less likely to have employer-sponsored healthcare, health insurance, more likely to be on Medicare and Medicaid. And compared to urban populations, they're more likely to be unemployed, less post-secondary education, and lower median household income. And so there's just less resources sometimes within rural communities. And we see that what makes a population potentially vulnerable or at risk in an urban setting is not the same as what makes a population vulnerable or at risk in a rural setting. And that, for people that work across both those barriers, it makes a lot of sense, but sometimes people don't always think about that. This was a publication that we did late last year. This actually got published in Geohealth, and where we looked at heat vulnerability in Omaha and heat vulnerability in different metro settings and rural settings across Nebraska and how they varied. And one of the things that we found was what actually determined what you were, if you were more vulnerable or at risk in an urban setting in Nebraska, it was much different than what was in a rural setting in Nebraska. And also one of the things that we kind of should pay attention to, and this is this publication that was just accepted not too long ago, is that your hazard and your risks are constantly changing. Your vulnerabilities are constantly changing. And so we looked at vulnerability and hazard for drought from 2010 to 2014 to 2015 to 2019. And what we found were both of those things changed. The drought hazard itself changed. Obviously, what were drought areas in that first period versus second period changed. But also one of the things that we found was even over that short period of time, how we considered a community vulnerable changed from one period to the next. Because these are dynamic systems. People are constantly moving, changing. Water resources availability are changing. And so that just kind of gets at some of those challenges that we face. And really thinking about these systems that we work in, our communities that we work in, is not as static systems, and that they're potentially constantly in flux. And so this really gets at one of the big areas. And so kind of transitioning over to one of the big areas that we're concerned about, which is the extreme weather events, especially in the context of flooding and drought, and the impacts that it's having here in Nebraska and the central part of the United States. One of the things I always like to put up here, and many of you are hopefully aware of this, we've been seeing a change, obviously, in the frequency and intensity of extreme weather events across the United States and across the world. We've been seeing more drought events, especially in the western part of the United States. We've been seeing more flooding and flooding rains in the central part of the United States. We've been seeing these shifts, and these shifts have been having impacts on our communities, impacts on our society. This is billion-dollar climate and weather-related disasters. NOAA has been documenting these from 1980 to up to present. And over time, they have been able to show that there are more of these billion-dollar climate and weather-related disasters. So these are climate and weather-related disasters that exceed $1 billion of economic loss. And they've been seeing more of those types of disasters over time, and they've been seeing more increase in cost over time. And this is all adjusted for inflation and that. And so 2020 was a really bad year, right? We had the global pandemic. We had everybody was staying at home. There was a lot of different things that we were facing. Social upheaval as well, and also dealing with some of the injustices that we face here in the United States. It was also a really bad year for climatic events, for the impacts that they had on the US. In 2020, we had a record year of $22 billion climate and weather related disasters. And so you think about how we're dealing with all these other issues, and then you add on top of it these climatic events that are potentially impacting our communities around us. 2021 was also a really bad year as well. And so we've been seeing more of these climate and weather related disasters. And in particular, here in the central part of the United States in Nebraska, we're definitely very prone to flooding. And I'll talk about that. We're actually one of the most flood prone states in the United States. When we think about flooding, a lot of times coastal areas get a lot of attention because you see the hurricanes that come in and those big devastating storms. But with these flooding events, sometimes they're overlooked, especially here in the central part of the United States. And it doesn't always get the attention that some of those coastal areas get. Actually, for example, with this particular flooding event, it really didn't hit national news. Back in 2019, we had this very large, impactful flood. We wrote up a little case study for it in the Lancet report if you want to read more about it. It was really interesting about the impacts that it had throughout Nebraska and the Central Plains region. But it was interesting to me because the flooding was happening. I could see the flooding, the impacts. I could hear from family members and from community members about the impacts. And then it wasn't until like maybe 4 or 5 days later that friends and family across the United States started contacting me, and they're like, I hope you're okay. We heard about the flooding that was happening in Nebraska. And I was like, one, I thought to myself, well, if I wasn't, I would already probably be in serious trouble because this has been going on for quite a while. But it also showed to me how sometimes these central states are overlooked when we're talking about some of these climatic disasters and what they potentially mean. And this one was really significant when we first got back in 2019. This particular flooding event, Nebraska was kind of at the epicenter of it. It cost at least $10.8 billion of economic loss and damage throughout the region. It was the costliest inland flooding event in US history. We're still seeing the impacts here in Nebraska, even years later. There were only about 3 or 4 reported deaths from this event, but again, those were direct, and so the indirect is still not fully calculated. Hundreds of people were displaced. We saw widespread damage to roads, bridges, levees, dams. The impact spread across Nebraska, Iowa, Missouri, South Dakota, North Dakota, Minnesota, Wisconsin, and even Michigan. And here in Nebraska, we saw impacts on healthcare. There were at least 2 hospitals that sustained damage. It also made it much more difficult to access some of those hospitals because some of them were literally flooded on all sides. We saw at least a dozen long-term care facilities that were evacuated due to the flooding. And then the lack of access to care went on for weeks and months, even after the flooding receded, because we see damage to roads and infrastructure that what was a hour or 2-hour drive all of a sudden became a 3+ hour drive. And so, like I said, Nebraska is definitely very prone to flooding events, and that definitely has impacts both on the immediate communities, but there are also a number of impacts on water quality as well, especially if a lot of our groundwater wells that became flooded, and you saw inundation within some of those flood areas, contamination. So drought's the next one, and I do a lot of work on drought. This is actually a big area where I focus my research on, and so I'm going to try to go over it pretty quickly. Droughts are incredibly impactful across the United States. They're one of the top billion-dollar climate and weather-related disasters. Over about a 40-year time span, we've seen about over 29 events that have exceeded $1 billion of economic loss. Pretty much every state in the United States has been impacted by drought in some capacity, which led to $285 billion of loss total over that 40-year time span. And that's just for the ones that exceeded $1 billion of economic loss. We're not even counting some of the smaller droughts that have had impacts. And then also on top of it, we estimate that, or NOAA estimates that there's at least 4,000 deaths that occur because of drought. And the interesting piece of that is, a lot of times when you see droughts, you also see heat waves. And so those 4,000 deaths are likely attributed to heat waves that have happened during these 29 major drought events. But that kind of gets back to it to some extent. Drought acts differently than many other weather and climate related disasters. It's not like flooding. Flooding and the impacts are pretty immediate. You can see exactly what's going on. Hurricanes, the same thing. Drought is a much more slow evolving disaster. It doesn't really have that kind of shock that many other disasters have. So the impacts are also not immediate. They are sometimes more delayed and indirect. And it can lead to causing like multiple different steps before you actually see a human health outcome. And also on top of it, the reason that we could get 4,000 deaths because surveillance, health surveillance is able to identify heat-related issues and how that can actually be relayed back to human health outcomes. Drought doesn't work in that way. Surveillance, when you go into the hospital, somebody can't write like on an ICD code, this person's here because of a drought. And so it makes it much more difficult to be able to identify some of those human health outcomes. But that's a big area where we're focused and trying to understand. Because drought does have impacts on human health. And anybody that works on drought really can see how significant it is, hence why it's one of the costliest climate and weather-related disasters. And so the way I look at drought is as a threat multiplier. Drought, similar to climate change, drought changes the environment around you in a variety of different ways. And those changes in the environment can have human health outcomes. It can lead to more intense, longer lasting heat waves. It can lead to conditions that are primed for wildfires. It can reduce water availability and it can reduce water quality as well. And then it can also lead to reduction of air quality and changes in the habitat that can lead to the spread of disease. I won't go through all of them. And so this is courtesy of Dr. Abadi, who helped put this on. She made this particular figure here. And so we see in that central part, the blue ring to show the ways that the climate changes or water cycle changes associated with droughts. And so we see rises in certain temperature, reduction of precipitation, lower snowpack, lower runoff, lower groundwater. Those things can impact our environment in some way. And there's all the different, or this is a few of the pathways that we have. And then that can lead to human health outcomes. And so that's just to try to illustrate that drought can lead to human health outcomes. The next step is, do we see any change in human health associated with drought? Well, there was a publication by a colleague of mine, Jesse Berman, out of, at the time he was at Yale, but now he's at the University of Minnesota. He identified in this study that droughts changes the risk of hospital admission and mortality in older adults in the western part of the United States. And Dr. Abadi just found out that her article was accepted, where we looked at Nebraska and found an increase in mortality in Nebraska, like I said, an increase in mortality during drought events in white females between the ages of 45 and 55 years of age, and white males between the ages of 45 and 65 years of age. There is a number of other populations that are also impacted. You'll have to read the study to look at all the different pathways. It was a nice study. And then, like I said, it can change as water availability, water quality, both in surface and groundwater. One of the things I just want to quickly throw up, and we have issues here in Nebraska associated with arsenic in our groundwater. There was a study that was done by the USGS that showed that there was higher levels of naturally occurring arsenic in private domestic wells during drought events. And then this is another part that I'm really interested in, which is understanding how these climatic changes, especially with drought, can potentially lead back to mental health outcomes, especially looking at suicide. We know farming communities have higher suicide rates than many other occupations. Farmers have higher suicide rates than many other occupations, and the linkage to drought has been known in a variety of different places around the world, including here in the United States. And so last year, we published an article, again, with Dr. Jesse Berman up at the University of Montana. It showed an increase in suicide in farmers, or sorry, not suicide, an increase in reported stress in farmers during drought, a major drought event that occurred when this particular survey was taking place. And this survey was basically a look at occupational injuries in farmers. But one of the questions within there was self-reported stress. And it happened to be that this survey was going over multiple years and it fell over a major drought event. And when we looked at that, the effect estimate for drought was 4 times greater magnitude than people reporting pain in other parts of their body. And so that basically, in summary, that drought event that occurred, the farmers were more likely to report stress than if they were facing some other bodily injury in some way. And so CDC has resources available to help public health officials understand this. But one of the things that I've been working on, this has been funded through NITAS, the National Integrated Drought Information System, and NOAA, is developing a strategy document for them to help better engage around with public health officials across the United States when major drought events occur. We had a big national meeting back in 2019 that happened in Atlanta, Georgia. This is in partnership with CDC and a variety of other federal partners. And then we've been having regional meetings. COVID kind of messed it up a little bit, but we've been having regional meetings to better understand some of the threats within the communities and within the regions associated with drought and human health. And that's feeding into that strategy document that we're building for NITAS. And with our regional meetings, one of the things we really try and do, it is locally focused. It is, we work with local partners to really decide on who should be at those meetings and who are the best to contribute in understanding the impacts of drought on human health. And so that strategy document should be coming out soon, and we're going to be sending it out to various partners for feedback and input. And so just be on the lookout for that as we move forward. And so kind of in summary, I'm going to try to wrap this up a little bit quickly. The other piece is that water quality piece. And like I said, Nebraska is facing a number of challenges, and there's certain small towns and communities like Hastings, Nebraska, that will spend $50 million on their system to reduce nitrate exposure to their community. And that community is only 25,000 people. And why are they spending all of this money? Why are they trying to understand this? Because why are they trying to reduce the exposure? Because of the potential human health impacts that this can potentially have on the populations in the community. And so that's one of the things that we're really trying to do is help with communication and engagement around some of the science so that we can be better informed and understand how human health is being impacted by reduced water quality within the state, and also learning from external partners as well. Nitrate in drinking water, many of you are probably familiar with this. It mostly comes from nitrogen fertilizers, animal and human waste. Regulatory limit set by the Safe Drinking Water Act, Safe Drinking Water Standards, is 10 milligrams per liter. Greatest exposure here in the, especially in Nebraska, is agricultural areas and also private wells, because private wells are not regulated under the Safe Drinking Water Act. And so people might not be taking measurements, or the measurements may be sparse. Nitrate has also been linked to human health through a number of different studies. One of the biggest areas of concern is methemoglobinemia, otherwise known as blue baby syndrome. But numerous other studies have not looked at the relationship of nitrate this regulatory limit is not set based off of other potential human health outcomes. Some studies have been showing that maybe lower levels than 10 milligrams per liter is actually necessary to reduce some potential health impacts. And so some of the strongest links, like I said, that blue baby syndrome, colorectal cancer, thyroid cancer, or thyroid disease, neural tube defects, also some pediatric cancers, which is actually an area that we're looking into. Like I said, Nebraska has one of the highest rates of pediatric cancer in the United States. This study that came out from some of my colleagues at UNMC showed that Nebraska was in the top 5. This is back in 2018. And some of my other colleagues have been trying to understand how that distribution of cancer, and this is where I've started to come in a little bit, how the distribution of certain cancers across the state are actually relating back to some of the potential environmental exposures. Up here, and this is not published results, this is just looking at straight visual distribution. The pink is indicating where watersheds in Nebraska are above the national average. Green is where watersheds are below the national average as far as certain types of cancers. This one is CNS tumors, central nervous system. Leukemia is B, and lymphoma is C. And one of the things I just kind of wanted to point out is when you look at CNS tumors and you look at where our row crop agriculture exists across Nebraska in the green and the pink, you'll notice that there is a pattern, a similar pattern there. And that's some of the work that we've been trying to focus on, is understanding some of those patterns and relationships. This was a study that was just published this year in Geohealth, looking at some of our cancers, pediatric cancers in Nebraska, and looking at water quality issues across Nebraska and how they were potentially related to each other. So first, well, I guess just to summarize, Nebraska counties with elevated atrazine, which is a pesticide, or nitrate levels, reported more childhood cancers than counties with that had lower levels of these contaminants. And so this is a big area that we're working on, and this is where that extension piece is going to be coming in as well, is education and outreach, and working with our extension educator to make sure that we can target populations that are at risk, greatest risk. And for me, those are in particular women that are pregnant, potentially, or could potentially get pregnant, and also households with children, especially associated with some of those issues with both methemoglobinemia and also with pediatric cancers. Also working to make sure that we better inform healthcare workers around some of the risks, because in some of these small communities, if you have a clinic, it might just be one doctor that serves that entire town. And so that might be the resource for multiple different health-related issues. And so making sure that we have better information for them. And then also making sure that we are engaged with community leaders around some of these issues. So, and just real quick wrap up here, one of the other big things that we're trying to do is train that next generation. I talked about the students that we're involved with, that are involved with this program. We also have a number of other students that we're engaging with as well, especially through the Med Center. One of the things that we have is the Clarum Hubbard Fellowship, and we had our first batch, and we're soon to have our second batch of new students coming in. I think actually the second batch might have been started. And these individuals are to really try to understand how, they've got funding to bring in students to help understand some of these environmental hazards that we face, especially around water and climate here in Nebraska. And that's run through the Water for Food Global Institute. We also have a student organization here at the University of Nebraska Medical Center. It's called the Healthy Earth Alliance. It started about a year after I got here. Some students, medical students, reached out to me, Samantha Cox, DJ Marr, and Tom Schroeder. All of them are now residents somewhere, who are really passionate about sustainability and climate change and wanted to try to do something here at UNMC to try to build awareness. That started off with just 9 students in total, and now we're well above 60. I think we actually might be above 100 students that run across all the different colleges within our campus. And they've been working on a number of different initiatives throughout the campus to get climate change integrated into the curriculum, to do more sustainability, and also engaging within the community as well. One of the big things that they really pushed for was a climate change and health enhanced medical education track. This is basically kind of a minor for medical students. And so we have 3 in our first cohort within this track, Anna, Morgan, and Bailey. They're just finished up their M1s. They're working with us over the summer, and then hopefully continue working with us throughout their medical career here. And we'll continue to get new students every year as well. And basically the premise of this is for them to understand how climate change potentially impacts human health, and also to do research around some of these issues as well. We also have some other students that actually just presented at a national conference, medical conference, about the ways that we're trying to integrate climate change into the curriculum here at UNMC as well, medical school curriculum. So in summary, central states are often overlooked when it comes to the impacts of climate change and environmental change on human health, but there's a lot of opportunity to understand those impacts and engage within our communities. This new program at University of Nebraska is designed to really tackle that water, climate, and health nexus, but I think it's a really unique opportunity to really advance some of the work that we're doing and be a hopeful leader in trying to address some of these issues. The health issues associated with water quality and quantity are very complex. And because of that, that's one of the reasons we really try to do this in a multidisciplinary approach and bring in a lot of different expertise in addressing and dealing with some of these issues. And hopefully what our goal is that we have a reach within Nebraska, the region, the United States, and across the globe. And we've got a number of different initiatives that we're moving forward with. We're in the process of hiring some folks. And so if anybody's interested, especially students or potential postdocs, don't hesitate to reach out. We're in the process of trying to grow. And so with that, I want to acknowledge my team and all the excellent work of my collaborators and funders to help make this potentially or make this possible. And so if you're interested in our program, don't hesitate to reach out to me or Megan Langle, who's program manager, but also director of operations, or visit our website and check out some of the work that we're doing. We have, I think, a decent newsletter looking at some of that. And yeah, again, thank you very much. And I look forward to any questions that you have.
Well, thank you, Dr. Bell, for a wonderful presentation. We have about 10 minutes for Q&A for this section, for this part, before switching to the early career folks. Please unmute yourself if you have a question at this point. So while we are waiting for the questions, there are a few questions that has been asked by the registered attendees, and also one question in the chat box. So I'm going to read through those questions. So one question in the chat box asked, what are the main features of the strategy document that makes it exclusive for US? In other words, how much applicable do you expect the US drought and health strategy document to be for other parts of the world, examples, India and Middle East?
Oh yeah, that's a great question. So that strategy is definitely US focused, and which makes sense because of NIDAS's focus, especially in the United States. But there's opportunities to expand that across the globe because we're getting really good information. And one of the things I've been really proud of is our engagement with regional partners. And so, it's fascinating to hear their stories and also help build collaboration and connection within some of these regions. And so, for example, we had a meeting up in Minnesota, and it was to cover the kind of that Great Lakes region. And one of the first things we do is we partner with a local health department, and the local health department kind of helps establish a community or a working group to really help identify what's that workshop going to look like, who are the partners that need to be involved. But one of the other things we do is try to get in that state climatologist as well. And so it's really trying to build some of these bridges. And one, the conversations that are ahead, it's really interesting to hear some of the individuals that maybe typically don't think of drought as a human health threat start thinking about drought in that context. It's also really interesting to see, for example, when we were in Minnesota, the state climatologist, I think, was in the process of revamping or getting close to revamping the drought strategy for the state, like the drought response strategy for the state. And then they saw some of the potential connections to health, realized that that wasn't being involved, and then was able to reach out to partners that were there at the meeting to potentially incorporate them in that planning process for what they're trying to do locally. And so I think the framework that we've potentially built is like a perfect framework, not perfect, but it is a good framework to be applied in other countries as well. Bringing partnership together, talking about threats, talking about solutions, and continuing that conversation. And I think one of the things I would imagine is some of this is definitely going to be applicable to outside the United States in trying to address some of these issues. Because internationally, we know that droughts have likely led to more deaths than any other climate or weather-related event, primarily due to famine and malnutrition. And so, honestly, we could learn a lot from the international community as well, because I think they've been much more engaged sometimes around drought as a health threat, where the United States, I think, is still kind of catching up as well.
Thank you. Another question we have is that when considering research questions that are centered in water, climate, health, how do you think about interconnections between research topics? For example, flooding, water quality issues, extreme drought, or do your lines of inquiry remain relatively separate from each other?
I'm very much a kill two birds with one stone type of a person. And so I like overlap. And when we talk about drought and when we talk about flooding, those have direct impacts on water quality in some capacity. And for example, I think, when I was talking about arsenic, one, and other potential contaminants within groundwater as well. And so, for example, here in the United States, private wells are not regulated by the Safe Drinking Water Act. Because it's not regulated, it's up to the individual that has that private well to test their water. I'm from a rural location. I know a lot of people don't test their water very regularly, if at all. And one of the things and so there's already that challenge to it. But then some of the work that's been done, whether it's arsenic, and some have looked at other potential contaminants such as atrazine, if I'm remembering correctly, that you can see higher concentrations in that, especially during certain climatic events, such as droughts or flooding. And if individuals are testing their water sporadically, and when we know that potentially maybe drought is having an impact on water quality and groundwater quality, we need to make sure that we're working in a way to better understand that, so that those individuals know to test their water more regularly, especially during times when conditions are maybe potentially more favorable for reducing water quality as well. And so, and that's really going back to one of the purposes of this program is, we don't want to just do research for research sake. We're really trying to do research that has an impact within our community and within our state and within our region. And that's, that translational research, and how do we actually do something that is useful for the communities that we serve as well. And so with that, we really have to think of all this stuff in a combined joint way, and making sure that it's facing that nexus, and that it's not just two different projects that are separate from each other, but that they are actually intertwined. Because with the flooding, we also knew during that flooding period, we saw challenges with water quality across the state as well. So that's a great question.
Thank you. Before switching to early career folks, I have a quick question myself. In your view, what are the main components of a successful interdisciplinary program in this topic?
Yeah, that's a great question, and it's a tricky one. You know, one of the things that I really wanted to do when we started this program is making sure, one, understanding the lay of the land. So we held a water and health summit, and this was to bring leaders across the Nebraska to really try to understand what was going on already in the state, because if there's already a lot of good work, and you know, and from some of my previous work, you know, working on drought related stuff, you could find that, you know, this person was working on something that was drought and health related, and this person was working on something drought and health related, but they never talked to each other in their same state. And so that's one of the things we didn't want to do. And so understanding what others are doing, I think that's incredibly important. And then figuring out where you best fit in and trying to communicate and educate. And one of the areas that I think we do best is we're definitely coming from a health approach. Other people may be coming in from a water resource approach. Other people may be climate approach. We're really trying to drive home that health piece because we saw that that was something that was missing. And so sometimes it's not about reinventing the wheel, but figuring out how you best fit in and then trying to build those partnerships and relationships to make sure that that can move forward. And the next piece was, you know, we already have a lot of good, talented individuals, especially within the state, and making sure that you're partnering with them and bringing them into the program. For example, I knew that one of the areas that we were missing was that policy piece, because obviously that's incredibly important. We have a person here that is a public health lawyer. That was the approach that we wanted to add to this program. So it's bringing in that new perspective and that new discipline. As somebody that works in a multidisciplinary area, you have to kind of be a jack of all trades, and that's important, but you also need to make sure you find people that are true experts in those areas and make sure that you can collaborate and communicate with them and bring them in as part of this process. And also just hiring good people and letting them do good work.
Well, thank you so much. We are at the top of the hour, so I will hand it over to Allison for hosting the early career development section.
Great, thank you so much. So now, folks, I will just let everyone know what's happening now. So the science aspect of Dr. Bell's talk has been covered by Dr. Body. So now we're going to transition from the Early Career Committee for Geohealth, talking about more questions that are broader, career path, and targeted more towards folks who are early in their career, maybe post last terminal degree 10 years. And Dr. Bell will talk about all things about where he is and where he hopes to go and those types of questions. So thank you again, Dr. Bell, for sharing that talk and also continuing to speak with us. So I think one of the first questions is just, so for any folks who also joined late, can you just provide just like a brief overview of your career path and sort of like what your role is now?
Sure. You want me to do that?
You can give the elevator pitch if you would like.
Sure. Yeah. You know, my career has been kind of a windy road for sure, a random walk. My undergrad was actually in biology, and then I did my PhD in biogeochemistry. I was very interested in climate change and the impacts it has on the natural system, the Earth. But as I was going through my PhD, I became aware that I was really interested in trying to do more work that was focused on application-driven science. Like I was really fascinated with how to do things that were more impactful for communities and for a variety of different areas. I got really fortunate. My first full-time position was through a cooperative institute that was associated with NOAA, the National Oceanic and Atmospheric Administration, which is in, it was at the time, it was the National NCDC, National Climatic Data Center, but now it's the National Centers for Environmental Information. And that was a huge transition for me. And I felt really fortunate, but also overwhelmed, because I remember the first time I walked in there, there was this sign that like, these are all the scientists that work here that were part of the Nobel Prize that won for, you know, the IPCC report. And I was like, wow, that's impressive. And it happened to be Dave Easterling, who's I think he's still a scientist there, if I'm not mistaken. His office is right next to mine. And my dissertation was based around a paper that he wrote, and I can't remember if it was Nature or Science. And so his office right next to me. So it was kind of like an intimidating, you know, situation just in general. There was definitely some moments of, do I actually belong here in some capacity? But over time, one of the things that I became really interested in was, how do I do more applied science and applied research that have especially impacts on society and communities? I first got hired there to do more hydrology type of work. And then over time, I built collaborations and connections with the Centers for Disease Control and Prevention. And at one point I was on a call with them, we were helping share data, and somebody said, boy, I wish somebody like you was over here to help us. And I said, perfect. And so I reached out to them and was able to develop this joint position between NOAA and CDC through our Cooperative Institute. And so 50% of my time was NOAA, 50% of my time was CDC, and I was able to work in this joint position. I did that for about 6 years, give or take. Got some really cool opportunities that I was really surprised by, because at that time, I remember thinking to myself, I was like, oh, you know, maybe someday some of my research will actually, you know, somebody will be interested in it. To 1 year later, I was going to the White House and working on a project in OSTP. And I was like, wow, that was a huge shift in just like 1 year. Like hoping someday that somebody cared about anything I did, to actually being able to go to the White House and work on a project looking at pandemic prediction and forecasting, which is something that was outside my realm at that time. And so I worked there for about 6 years. And then this opportunity came up, and it was actually a colleague of mine from here at the university. It was actually at the University of Nebraska-Lincoln, said that they were trying to look for a position, or they had a new position around climate and health at UNMC, and he shared it with me and said, would you be interested in applying? I put in an application, I ended up getting the job, and so the next thing I know, I'm here and I've been working here. And one of the things, I wasn't scared of moving to Nebraska because I'm from Nebraska. I'm not giving you the short version, I'm giving you the long version. So
this is great. This is great.
Moving to Nebraska, I wasn't really afraid of moving to Nebraska. And so because of that, there's not always a line of people moving to places like Nebraska. There's a line of people moving to certain other places, but and the way that I kind of viewed it, and I was talking with some of my colleagues that were asking me, like, why would you want to go to Nebraska to work on climate change? And I remember thinking to myself, I was like, well, if I go to some of these other states where there's already really established programs and work, then I'm literally trying to figure out where I can carve out my niche. Like where do I elbow my way in to try to get some little influence? Because the meter is already over here. And then the way that I really looked at it in Nebraska, I was like, there's a lot more room for growth. And so coming here, like I could establish and be like, I want to work on this. I want to work on this. And so I had a broader plate to basically to fill up, which has been good and bad in some ways, because it's hard to say no when you're in that situation. So you're like, oh, I want to take everything. And so through that, that's honestly one of the reasons that we have the Water, Climate, and Health program, because if I was to go to some other larger institution, I might not have been the director of that, but I filled a unique role here. And because of that, when that opportunity came up, I was able to be the one to take advantage of that role as well. That's at least the way I see it.
Excellent. Thanks so much for that background. That was really informative for me, and I think for other people here. And I just want to, as a housekeeping note, if folks have any questions, there's a person here that you can just chat, ask questions here, and they'll be collated and I can ask them on your behalf. But one question that I do want to start with as folks are asking their questions is, as you were telling about sort of like your windy road, is that the sense I got was that you have a lot of what I interpret as like fearlessness to sort of just go after those opportunities as you see them, going to carve out your sort of like pioneering where you are in Nebraska. My question is, I guess this also goes to a lot of what's common, and you touched upon it as well, is the imposter syndrome. Is something that's pretty widespread, and especially early career researchers.
Yeah.
So I guess, where do you think like that sense of like fearlessness came to sort of just like go after these opportunities? And if you have any sort of advice for folks who are in an early career transitioning to maybe wanting to pioneer themselves as you have.
Yeah, that's a great point. And, you know, honestly, like I can talk about that imposter syndrome quite a bit. When I, in just full transparency, when I finished my PhD, it took me like well over a year before I even felt comfortable with anybody even calling me doctor at that point. Because I was like, I don't even know if I earned that distinction. And then, you know, coming from a small rural community, you know, my graduating class in my high school was like 30 kids, which, you know, there's like hardly anybody there. Very few people went to college. Like, I know when I first showed up to college, which kind of set the stage for a lot of it. When I showed up to college, I was like, oh my goodness. Like, I didn't realize how poor of an education system that I had, or how poor of an education I had before I went there. And so it was a lot of catching up. And because of that catching up, I always felt like I was a little bit behind everybody else, just writing and a lot of different things. I remember it took me until like my junior year of college before I actually understood what an AP course was, because we didn't have AP courses. And so people kept talking like, there's an AP course. I'm like, what the heck are you talking about? And so there was a lot of that to overcome. But I have to say, like, I don't know if it's fearlessness or just blind stupidity. Because I, you know, within that, there's like part of me that is constantly trying to prove myself in some capacity. And so I'm willing to walk in and just take a risk at times, and risk pay off. I think if you're nice and you pay attention and you ask good questions, you do all these things and you work hard, you're going to overcome any of those feelings of inadequacy that you have. At least that's my opinion of it. And I've had this since I was like a little kid, is just this blind faith in myself that I'm like, I'm going to figure this out one way or another. And so even when I've definitely like I don't know what the heck I'm doing, or if I'm on the right path, or I keep thinking to myself, I'm like, I'm going to actually get there in some way, in some fashion. And so, for example, when we were developing the collaboration between NOAA and CDC, and they were like, hey, you know, wish we had somebody like you over here. And I was like, perfect. I'm one of those people. And I've never been really that afraid to just be like, okay, I'm going to try this. And if I fail, hell, at least I failed trying. Like, failing in a corner somewhere is even worse. So at least I put myself out there. And so with that, you know, I remember there was like two parts when I talked to my director, because it's always good to make sure you have good mentorship. And that's one thing I highly, highly recommend, especially in the early part of my career, was reaching out to people and finding good mentors, because I found some that were very helpful. And luckily for me, my director at the time at the institute that I was, he kind of had my back in certain ways, which made me feel a lot more comfortable with taking risks. And so when I was reaching out and I was like, I'm going to do this, and I was talking to him, and I was like, and I always was making sure I was communicating with him. And I said, you know, I can do this in two different ways. I was like, if I build this relationship with CDC, one, I need to know, are there any restrictions, or are the chains off and I can just run? And he goes, chains are off. And I was like, okay. I was like, I might get in trouble. I might do things wrong. But as long as I know that you're okay with that, then I can move forward with it. And so that's also part of it as well, is this like, yeah, so maybe just blind stupidity at times that gets me through things. But yeah, so I think there's multiple different approaches to it. I know I've had definitely a number of different apprehensions within my career. Like I said, after I finished my PhD, I think I actually went and I was depressed. I think I was probably clinically depressed, not to be dark or anything at this moment, but yeah, I think I was facing some level of depression during that time period. And I think it was just because I'd finished something that I worked so hard for and didn't really know what the next potential step was. I didn't feel like there was like a pathway that I was following. I felt a little bit kind of blind at times. But again, it was just making sure, building relationships, talking to people, and trying to make myself feel more confident in myself as well. And then realizing, and science is wonderful with this, science, you fail. Like that is like one of the things you have to be accepting of, is you can do a really great experiment and that experiment might fail. And so with that, there are times that you're just going to fail with what you do, and just be able to recover. And so I think that's part of it too, is just being willing and accepting that at times you're going to fail, and sometimes you just have to figure out how to recover from it. Yeah. I don't know. That was another long explanation. How about that, Allison?
Thank you so much. Thank you so much for being so like vulnerable and just like being candid in your experience. I think a lot of people, I know I resonate with a lot of points you had made, and I, find it inspirational that you, I would say, I would still classify it as fearlessness, maybe same coin, fearlessness and blind stupidity, but I found that like very inspirational, and I think others as well. But I do want to also like move to a next question. You were talking about finding so much of your work is interdisciplinary, transdisciplinary. And you said one of the pieces of advice you gave during the talk was to like find the right people to hire, surround yourself with a good team. I guess thinking about as an early career researcher, how do you be a good collaborator once you're tapped, or you want to be one of those people that is seen as someone that can be a good team member for these like broader sort of Geohealth large consortium collaborations?
It's tricky. Collaboration is always hard. And it's just, you have multiple different pieces, and it's trying not to let things fall off to the side, which sometimes you do. I think the best thing is definitely, the first thing, and I have to say, one of the smartest things that I did when I first came on as a faculty member at UNMC was I hired a postdoc. And that postdoc is actually in my screen up in the top right. She's now research faculty and hopefully transitioning to like full faculty, Dr. Abadi. And it really, and this is especially for anybody that's, thinking about being a postdoc at some point, is having that ability to just kind of work independently. And she definitely did that. She was able to kind of keep things afloat as far as the research, especially when we're trying to build some of this other stuff on the side. And so going back to that interdisciplinary, multidisciplinary approach, and I've done that multiple times throughout my career. Like I try to find really good people to work with. When I was at NOAA, I had a collaboration with a colleague that was kind of on the same level as me, that he really wanted data. I had data. He did machine learning. I was interested in machine learning. And through that, we had a number of different publications and collaborations. And sometimes, especially in the early part of your career, one of the things I think is really important is finding one or two really good collaborators. You don't need 100. Because that's where you get, that some people call like death by 1,000 cuts. It's because sometimes you, especially early in part in your career, you don't have a lot of resources. It's really good to find those people that you can gravitate towards and you can rely on, and that they're a good resource for you in some capacity. Because I see that sometimes where people are like, oh, I want a million collaborators. And I'm like, that just means you're not going to get anything done. And I say this because one of my favorite, and I've used this all the time. I was there's a colleague of mine that works at NASA, and we were at a big meeting together. And we were sitting next to each other, and he was working on his computer, and I think I was working on my computer. And all of a sudden he just turns to me and he's like, and he shuts his computer and he goes, "Do you feel like you do anything good or well anymore?" And I was like, and he's like, because he's like, I feel like for him, he was talking about how he's like so stretched because there's so many different projects that he has to work on that you never feel like you do anything like you did when you were a PhD student, especially. Because when you're a PhD student, you can focus in on like 1 to 3 projects and they are yours from beginning to end. And then as you move through your career, sometimes you're a piece of a project, or you have to trust that somebody else is running this project in some capacity. And that's also tricky. But for me, and especially developing and so I think that's part of it, is making sure you don't get yourself in that situation, especially too early. Let your career develop a little bit, find those good collaborators and those good partners. And that's what I really try to focus on is, life is too short to work with pains in the butt. And some people might think that I'm that, but, and so I think, finding those people that you really mesh with and you can work with and you can really start to move forward with on projects, that's incredibly important. And then I would say, the other piece of it is I've always been fascinated by other people's work. I love that interdisciplinary, multidisciplinary approach. I like new perspectives on things, because I realize I can't be an expert. I talked about earlier, I can't be an expert on law and policy. I've taken a law and policy course, so I can kind of talk about it. I understand like some of the basic principles, but I'm not an expert on it. And nor should I be. But that's where building that collaboration and that interaction with individuals like that, it's so important to really help move things forward and build better teams around you. I don't know if that made, did I answer your question or?
Yes, that was excellent. Thank you so much. So I guess moving into another one, is there any advice that you wish that you had received when you were starting out your career?
Yeah, I think the biggest one is, let's say if you, in any route, if you're going into academia or even not even academia, is like setting yourself up also with good mentorship. I wish I would have realized like how important that was earlier in my career. Sometimes I just got lucky with the mentors that I had, and there were definite times where I could have benefited from different mentorship at certain points. For example, writing grants, which is incredibly important, is no matter where you're at, and it seems like it goes across the board. Writing grants is incredibly important. I remember I was trying to write grants early in my career, just as like an individual by myself, being like, I can write this, and nobody would give me funding. And over time, I was able to build up my career more, build up my reputation and my science, and then I became more successful as I applied for grants. What would have been much easier in my life is if I would have partnered with experienced grant writers, people that had been successful in some capacity, so I could see what that success looks like. And I think that would have made my pathway easier. And that's where I think mentorship is so important, because if, it's nice to collaborate with people on your same level, but you also need a few people that are above you a little bit, just so that that you're not just going off into like this void over here, and they're actually moving you forward in the right direction. And I hope I have that environment. I try to do that with Dr. Abadi, since she came on as my postdoc. She can tell you if I'm completely off base there. But yeah, and that's kind of one of the things that I highly recommend. And yeah, and having multiple mentors and having multiple people from different perspectives to be able to help you through your career, not just the person that employs you, but also people around you as well.
Excellent. Dr. Abadi had a positive reaction to that one. So I think you're speaking the truth. Excellent. All right. So I think we can probably have time for maybe just one or two more questions, and always a good one, especially now with so much remote work. Do you have any work-life balance strategies, either that you implement yourself or aspirational?
Aspirational is probably the best one. So I'm probably not the best example of this by any means. Like, if anything, I highly recommend having a good work-life balance. Especially during the pandemic, I realized I was running myself ragged, where there was no separation for me when I woke up in the morning to from my job to when I went to bed at night. Like, it just felt like it was just nonstop me working. And I really had a hard time shutting that off. And I still have a hard time shutting that off at times. As some people may know, I sent out an email last night at like 1 o'clock in the morning. And so, because I was working on some stuff. But I highly recommend that. Taking care of yourself, eating appropriately, exercising, doing anything that you actually enjoy. It's so important. One of the things I love doing is riding my bike, and I love when the weather is actually nice and I don't have to dress up for work, that I can just ride my bike to work on during the summer, especially on a regular basis. Summer or winters in Nebraska are a different scenario altogether. And so, yeah, finding ways to step away, you really do. And I think making harder, like, cutoff points within your day and being like, this just is like, this can't happen after this hour. Again, it's much easier for me to say than actually do. But then I think the other thing that's been really helpful for me during the pandemic, especially, everything turned into a Zoom meeting. And I'm still struggling with how to potentially balance that to some extent, because my days can literally look like 8 or 9 Zoom meetings one after another. And it gets a bit much, especially when you're trying to get actual work done. And that was one of the issues for me, is that, I'd get through a chain of Zoom meetings throughout the day, making sure projects are moving forward and partnerships are still all this going on. And then at the end of the day, I'm like, okay, now I need to do my work. And one of the things that I have tried to do, and I've been fairly successful, is just blocking out days and just being like, this isn't for meetings, this is for me to actually do work. And that's been really beneficial, because that helps me reduce the amount of hours I have to work off. Occasionally you have to do it. Grants are coming in, somebody's asking for a paper or something to be reviewed. So occasionally you have to work at night. But making sure that I have time that is dedicated to me actually getting work done throughout the week is incredibly important. So that way I have a free weekend and I'm not always working on stuff. Now, on the opposite end of the spectrum is I really love what I do. And I do science because I'm fascinated by science and I love science. And so it is hard for me to step away from work, because when people are like, what's your hobby? One of my hobbies is my job. and so it is like kind of that hard part where you're like, if you really like what you do, to be able to just kind of walk away from it every once in a while. But you still have to do it, otherwise you burn yourself out.
Thanks. That was excellent advice. And I think just one more question, just looking forward, is where do you hope to be in 10 years in your career?
I love and hate that question so much. I love to ask that question because I like to hear what people say. Also, I like asking that question because I hate that question. And so, because, for me, if somebody would have asked me 10 years ago, would I be in this position? No. And I just never expected this trajectory. And one of the things I've always done is I have a general idea where I like to go in my career. And I have goals, and I have short-term goals and I have long-term goals. And if the short-term goals, with any of these goals, they're flexible depending on, like, I'm not rigid about any goal that I have. I'm very flexible that if an opportunity comes up and it's a really good opportunity, I want to take advantage of that. And I want to be able to navigate that in some way. And I'm always the path of least resistance type person. Like I like being able to figure out, what's the easiest way to get from point A to point B. And I think that's also kind of going back to what you're talking about, like how do you build, your career and all this stuff. Like, I'm like, I don't know, it's like the Matrix or something when they're like shooting at you and you're just like kind of like floating around. You're like, okay, well, I just got to dodge some of these like obstacles. And I've noticed with some people, like they hit an obstacle and that's it. Like they just can't move past that. They're like, I had one idea that I wanted to accomplish and there's just no more that pathway is done. And for me, I'm like, success looks like multiple different things. And so sometimes like, I think this is where my career is going, but I'm like, all of a sudden I realize, I'm like, that's not going to happen. Like there's too many barriers between that. But I see an opportunity over here that's a little different than what I originally intended, but it's a good opportunity. So I'll take advantage of it. And that's kind of how I've gone from, I started off in biology. I did biogeochemistry. I did hydrology, climatology. Then I moved into human health. And now I'm pretty much full into human health. Like that just was not a trajectory I think most people would have expected in any capacity, nor does it make sense at times. But it really is like, I see opportunities and I just try to take advantage of those opportunities. And by taking advantage of those opportunities, sometimes another opportunity comes up. And knowing also at times that certain things you just have to say, this isn't a good opportunity anymore. I just got to walk away from this one.
Excellent. Thank you so much for your time, Dr. Bell, and just sharing so much of yourself with us. And at this time, I'll switch it over to Dr. Body for any closing thoughts.
Thank you so much, Allison. And I definitely can vouch for the creative and supportive environment that Dr. Bell has created at UNMC for us within the past 4 years that I have been here. Well, we are close to summing up everything. And thank you, Dr. Bell, for the great presentation today. We learned a lot. I appreciate your time.
Well, thank you so much. And I pay you to say that, so I appreciate it. But no, I really appreciate it. Thank you so much for taking the time. I don't know if I provided any good advice, but hopefully, if anything, maybe I made a few of you laugh along the way. And so with that, thank you. And don't hesitate to reach out. I always like hearing from others as well.
Thank you so much. And thank you everyone for being here, staying this long, and have a wonderful weekend. Thank you. Bye.